Hospital patients and long-term care residents spend an awful lot of time in their room. Hi, I'm Kathy Getrist, and today we're going to be talking about the patient's environment. The patient's environment or unit is the room that contains the patient's belongings and sometimes their furniture. The size and layout of the unit depends to a great extent on the type of health care the patient is receiving. For example, the patient unit in a hospital situation might be rather small and bare in comparison to the long-term care unit where the person is going to be spending the majority of the rest of their life. That would be more home-like and more personal. Age, illness, and activity all affect comfort. So do things like temperature, the ventilation system, noise, odors, and lighting. These factors can be controlled to meet the person's needs. Healthcare facilities have heating and air conditioning systems and ventilation systems that maintain a comfortable temperature and provide fresh air in the room. For those of us in our home or apartments, a comfortable, healthy reading for a temperature would be somewhere between about 68 and 74 degrees Fahrenheit. Infants, the elderly, and those that are ill frequently will need warmer temperatures than that, however. And you probably are aware that older people, because of the circulatory problems, tend to want to dress more warmly than those of us that are more active and younger. You'll see them having lap robes on their waist or on their lap while they're sitting up in a wheelchair, or putting on sweaters when it seems perfectly comfortable for us. As a result of this, healthcare facilities, particularly long-term care settings such as a nursing home, may have a temperature reading that's above the average of 68 to 74 degrees. Stale air and odor also affects comfort level of an individual. A good ventilation system can provide fresh air and moves room air. Ill people are sensitive to noises and sounds around them. Sounds such as banging of bedpans and utensils with trays, buzzers going off, loud conversations in the hallway by healthcare workers, all are unfamiliar sounds to the resident. And it might be disturbing to them. What might seem common to us in that setting may be new and even frightening to an individual that's in one of the patient care units. Things such as you might have a resident that yells out periodically. You could have somebody that moans in their sleep, or any number of unfamiliar sounds, buzzers that are going off, all things that are unfamiliar to an individual, and it's your responsibility to help them feel safe and secure by giving some meaning and what the cause of that particular noise might be. Healthcare facilities are designed to reduce noise. For example, the draperies in the room, carpeting helps diminish noise. Many of the old-time aluminum, stainless steel wash basins and bedpans have now been replaced by plastic, which do cut down on the noise level. Promptly answering phones and intercoms will help decrease noise. Never turn a television on in a patient room or turn it up unless it's the patient's request. I've known of situations where caregivers have gone in to care for a resident and flipped the television on and immediately got to their favorite soap opera, maybe Days of Our Lives or whatever, to see the latest episode. This is not appropriate. The time that you're in the patient unit should be focused on interaction with that individual resident. Many odors occur in healthcare facilities. Some of them are pleasant, such as the smell of food or the scent of some fresh flowers, but some can be very unpleasant as well. Things like bowel movement, urine, vomit, a draining wound, all can cause very unpleasant odors. Ways that you can help reduce those odors are to promptly clean and empty and clean any waste from a bedpan, change soiled linens and briefs that the individual might be wearing that would be soiled, clean any incontinent resident thoroughly with soap and water or a special peri-wash solution to help cut the odor, and generally provide really good personal hygiene so that the patient's body and their breath have a fresh and pleasant odor to them. Good lighting is also needed for comfort and safety of both patients and staff. Shadows, dim or glaring lights can cause problems such as falls. It can cause headaches and also eye strain. It's important that you adjust the lighting to meet the changing needs. For example, pulling blinds or drapes in the room if there's glaring bright sunlight coming in. The overbed light, that's the light that is right above the bed, has an adjustment on it so that it can have soft, medium, or bright light. And when you are providing care, you probably are going to want to have bright light on so that you can accurately see what you're doing. Make certain that the individual has the signal that allows them to adjust the lighting to their comfort level once you've left the room. Protecting the patient's safety is at the center of all of our healthcare delivery. A safe unit is one that is arranged such that there are not accidents that occur. That means all equipment that you are working with needs to be in proper working order. Be sure that if you find a wheel that does not look like it's on correctly, or it's wiggling, or a part of a wheelchair is missing, or any other thing that might go wrong with a piece of equipment, notify housekeeping or the nurse so that that can get corrected and prevent an accident. Always keep the signal cord within reach of the patient. What happens sometimes if it's not within reach, they may need to go to the bathroom, and they will get up on their own if they can't reach some assistance, and in the process may fall, and a prevention of that could have occurred if the signal cord had been easily accessible to them. Be sure that the area where the patient is neat, clean, and uncluttered, not only for the patient's sake, for staff and visitors as well, to be able to maneuver around and not fear of tripping over cords or over waste baskets and so forth. Safety bars and emergency call systems are provided in the bathrooms and also in the hallways, and make sure that your patients are aware of that and know how to use them. The bed is always positioned closest to the floor when care has been provided and has been completed. The bed is able to go up horizontally and should be raised to a comfortable working height for good body mechanics while care is being given. But once it's completed, you always have the bed placed in lowest position so that if the individual is trying to get out of bed, their feet can reach the ground safely. Also, be sure that wheels are locked when not in motion. That means the wheels on the bed, that means the wheels on a walker, or the wheels on a wheelchair. When the patient is not using them, they should be locked, or if they're going to be transferring from, for example, a wheelchair to the toilet, be certain that the wheels are locked for safety's sake. Respecting the patient's privacy is one of the principles of good nursing care, but it's also mandated by the Patient Bill of Rights. That means that window blinds and drapes need to be closed in an effort to provide privacy while care is being given. Privacy screens or privacy curtains are always pulled around an individual that might be sharing a room with someone else. Curtains protect a person from being seen by others. However, as you would know, it doesn't block out any sound or prevent conversations behind the curtain from being overheard. So be mindful of that when you're giving care, and keep your voice level a little bit lower so that that conversation can remain private. Each unit provides a private closet and furniture items for the patient's clothing and their personal belongings. Staff are also instructed to always knock and wait for a response before entering a resident's room in order to help maintain their privacy. A restorative environment promotes independence and self-care. It increases the person's self-esteem and motivation. In a long-term care facility where residents may be staying for long periods of time, efforts are made to create a home-like environment. It's done by the use of wall treatments and furniture that's designed to look less institutional as it might be in a hospital setting. Residents are encouraged to bring in their own clothing, some of their own furniture, and sometimes they will bring in photographs to hang on the wall, all in an effort to make it seem more like home, of course, as space can permit. It's more difficult to maintain a restorative environment in a hospital type of a setting. While the units are neat and clean, you can hardly say that they really look home-like or comfortable. These patients, though, also need a restorative environment, as those do in other long-term care settings. You're going to have to be a little bit more creative in order to get that kind of a restorative environment in a hospital. Some of the ways that I've seen it work is allow the patient to display some of their greeting cards, get well cards that they might have, being able to display them attractively, maybe on a wall board or at their bedside stand, allowing them to bring in a special pillow of their own, maybe a teddy bear. If you have any questions, check with the nurse, but frequently those items are allowed to help things feel a little bit more like home. Each unit contains furniture and equipment to meet the individual needs. This equipment would either be located in a single or a double room. A private room is a single room and it only contains one bed. A semi-private room, sometimes called a double room, contains two beds. Years ago, we also had frequently what would be a ward. A ward could be 4 beds, could be 8. Maybe you've seen old movies where there are even more numbers of people than that in a given room. Those are not nearly as popular as they had been in years gone by, and you will see very few of them, although there are a few places left that may have 3 residents in a room, but it's becoming more and more uncommon. Each room is numbered, and in addition, if the person is in a semi-private room where there are 2 beds, the bed is also numbered with either an A or a B, or 1 or 2. So it could be room 841A or 841B. Generally speaking, the A bed would be on the left. They go in a clockwise fashion, so A would be on the left, B would be on the right. Or if the beds are a nearer one or farther, generally the one that is closest to the entrance to the room would be bed A, and the further one is bed B. Beds have electrical or manual controls. They always used to have manual controls, but you will see that most of those beds are now being replaced with electrical controls. They're raised horizontally to give care, as was mentioned before, so that you can prevent bending and reaching and help maintain better body mechanics. Beds must be returned to their lowest position, however, when care has been completed. There are 5 basic positions that a bed can assume. The first is called a high Fowler's bed. High Fowler's position is where the head of the bed is elevated 90 degrees, or it's at a right angle. The primary time that you would have the bed in that high position would be when the patient is eating to help prevent choking. They would be in a high Fowler's position. The next position is called a Fowler's position. That's where the head of the bed is about 45 to 60 degrees. The individual is in a semi-sitting position. And the next one is a semi-Fowler's position. Semi-Fowler's means that the head of the bed is elevated about 45 degrees and the knee position is elevated about 15 degrees. This is a comfortable position for an individual, and it helps to prevent them from sliding down in the bed by having the knee gatched, is what we call that, when the bed is elevated, or the foot of the bed is elevated a little bit. Raising the knee position, however, can cause some problems with circulation, and that means that you will need to check with the nurse before assuming that that semi-seated position, that semi-Fowler's position is what is used in your facility. Sometimes a semi-Fowler's position might mean that only the head of the bed is elevated about 30 degrees and the knee gatch is not elevated at all. So be sure that you check in your facility of which definition of semi-Fowler's they're going by. Trendelenburg is another position. Long word for a position that means that the head of the bed is lowered and the feet or the foot of the bed is raised. A time that might be used would be if the person has going into shock and they want to immediately get blood supply to the heart and brain. Trendelenburg can help that individual. You need to get permission, and there is a written physician order before you would place an individual in Trendelenburg position. The last bed position is called reverse Trendelenburg. As the name suggests, it's just the opposite of Trendelenburg in that the head of the bed is up, but the feet are down. Again, with that position, you would need to get a physician order. Side rails are attached to all of the beds in hospitals, but rarely will you see them used nowadays in long-term care settings. Side rails in the past were thought to help prevent falls. Research, however, has suggested that side rails don't necessarily accomplish this goal. In fact, many falls occur when the patient has their side rails elevated. This can result in serious injury and even death. Before you use side rails in your facility, know the policy in your setting whether or not side rails are permitted or not. If they are used, be sure that you check them, that they are attached securely so that they may not come down inadvertently when the patient puts their arm on it. Side rails should never be used to attach things such as catheter bags, IVs that have tubings. Those kinds of things can cause problems if you raise and lower the side rail. You can actually pull out a catheter if it might be, pull it out from the patient and cause harm to them. So never place any attachments on the side rails. The next item is an overbed table. The base of an overbed table slides underneath the bed, and the top of the bed, of the overbed table, slides across the patient's bed, or sometimes they will use it next to the patient's bed. The top portion is adjustable, so you can raise it and lower it to whatever seems to be the right position for the care that you're providing. Patients use these overbed tables for a number of reasons: for eating, for maybe writing letters, or can be used for providing care by the caregivers. It's considered a clean area, however, so you would make certain that you never put a bedpan, urinal, or other soiled item on that overbed table. It's also important that you clean the overbed table several times a day to maintain its sanitary condition. The bedside stand provides storage for an individual's personal care equipment. The top drawer usually houses things like, can be toothbrush, toothpaste, deodorant, maybe a comb, brush, glasses, personal items that the patient can retrieve rather easily. The lower drawer provides storage for the wash basin, bedpan, and other kinds of equipment. Each unit has what's called standard equipment, and that means that each unit would contain a wash basin, a bedpan, a urinal, and an emesis basin. Also, a water container would always be provided for an individual. Although most people come to a healthcare setting with their own comb, brush, toothpaste, toothbrush, those things are available if need be by the healthcare facility. Many facilities have a bathroom in each room. Some of them share a bathroom between two rooms. The toilet, sink, call system, and mirror are standard items in a bathroom. Sometimes you will have a tub and a shower in a bathroom, but that is not always the case. Handrails are always attached to the toilet for safety's sake. Toilets in many facilities are higher than the standard toilet, and that's so that it makes it easier for people who are in a wheelchair to transfer from the wheelchair to the toilet and back. It also makes it easier for people who have severe arthritic joints to get up and down when the toilet has been raised. The call system allows the patient to communicate with others that are there to care for them. The call light that is at the bedside is connected to a call light above the door of each room. It's also connected to the nurse's station. When a patient pushes a button at the bedside, the light goes on over the door, and it also goes on at the nurse's station. Staff members must be alert to the call system turning on and answer that light promptly. The light is turned off by the caregiver when they come back into the patient room to assist. The patient needs to be shown how to use that call system because it would be something that would be unfamiliar to them prior to this coming into a healthcare facility. An intercom system that's available in many facilities allows the nursing team members to communicate with the patient from the nurse's station. It also allows the light to be turned off from the nurse's turned off at the nurse's station. Call lights are also standard equipment in each of the bathrooms. Many facilities furnish patient units with other equipment. It's pretty common that in a patient unit nowadays there would be a television, a radio, a clock, a telephone, and some other items that might be available for their comfort. In addition, in some facilities you will have wall-mounted blood pressure apparatus, suction, oxygen equipment, and you might have what are called nursing care centers in a patient unit. A nursing care center would house many items that it's like a mini nurse's station in that there would be medications for the patients, many of the sterile and clean supplies that are needed. Maybe even the patient chart is there. So you'll see some variation in the amount of equipment that is in each patient unit. Some guidelines for maintaining a patient's environment. Make sure that the patient can reach the overbed table and the bedside stand so that they're not reaching unnecessarily, stretching their arm out and possibly falling, trying to reach the overbed table that could be housing their telephone. Arrange their personal items as the individual prefers. Keep the call light within reach of the patient at all times. Keep the telephone, TV, and light controls accessible too, so that you as a caregiver are not contacted unnecessarily to help them with those items. Provide needed supplies such as fresh water and facial tissues as they need. Handle equipment carefully to help minimize the noise and explain unfamiliar sounds to the patient. Empty waste baskets as often as needed to prevent clutter and minimize odor. Respect the patient's belongings. An item may not be important to you, but it could have real significance to a person. Something that comes to mind would be just simply a scrap of paper that's on an overbed table. It might have some important phone numbers for the patient. It might be some questions that they've jotted down that they want to go over with the nurse or physician. So always ask before you discard things like that. Don't throw away any item without the patient's permission. Don't become so concerned with the neatness of the room that you forget the patient's rights and preferences. And finally, don't move furniture and belongings of the individuals. People, particularly with poor eyesight, rely on memory and a sense of feel in order to locate items in this probably strange environment. One final note that I would like to talk to those of you caregivers that will be working in a long-term care facility such as a nursing home. These residents have left their private homes. Each one of them at one point in time lived in a home much as you or I do, or an apartment, and had all sorts of personal treasures around them. Now the person lives in a strange place, probably even has to share a room with someone that is not a relative or a friend of theirs, but in fact a stranger. Leaving one's home is a very difficult decision for these folks to make. Therefore, it's important to make the residence environment as home-like as possible. Ways that you can do that is encourage family members to bring in personal items that the resident has real attachments to. Framed pictures, things that can be put on the wall, plants, little special knickknacks that have had special significance to the individual. Maybe a footstool that was hand needle pointed by someone, or some other special item. Encourage those things. Remember, this facility is now the individual's home. You and other health care members must keep and must help the person feel safe, secure, and comfortable. A home-like environment goes a long way to help maintain a person's quality of life.